Okay, hi folks, it's Dr. Christine here. I wanted to talk to you today about a subject that I've been thinking about, reductionism versus dimensional understanding. And I wanted to put those two aspects of understanding human health in 5 dimensions and how I've seen it over the 40 years in my healthcare side by side. Now, reductionism refers to the practice of explaining complex human phenomena, illness, brain health, mental health, usually complex, by isolating and prioritizing single levels of explanation, most often biological mechanisms. A classic example in depression was the serotonin hypothesis. You get depressed because you don't have enough serotonin in your brain, so all you need to do is take a pill to elevate it. Now, sadly, it wasn't that easy, and we've seen that with the disaster that the SSRIs and other psychiatric medications have brought about. Now, the approach generally has enabled major scientific advances, but it becomes limiting when you apply it as a worldview. Nice, like it has to apply to everything. Really, it is a method, especially when it applies to brain and mental health. It's just a method, and it's not 100% valid. Now, here in this article, I explore how this aspect, reductionism, that scientific medicine and psychiatry has done, can obscure the lived relational, environmental, and meaning based condition that shape mental resilience and distress over time. Now, I have a lot of experience in history and philosophy, and I'm doing more research. Of course, I don't know everything. But in 65 years of life and over 40 years in healthcare, being a patient, being a doctor, being a physician, a coach, talked literally to thousands of people over time, I have gained an understanding that's a little wider than other people, and I want to invite you to explore this with me. And I'll put the link underneath this video so you can see more, because I find it very important that not to frame anxiety, depression, or diminished resilience as an internal malfunction. That's your fault in a way. I want to invite you to consider what really our brain has been asked to adapt to and what conditions we would need to allow resilience to take root or to falter. Now, this article is part of a new book and series called The 5 Dimensions of Human Health, and I want to invite you to have a look. There will be more, and you can, of course, if you want to, go on the email list and read more about it. And tell me when you are on the email list, you can reply and let me know what you think. There's no obligation, there's nothing for sale here. I'm just interested in sharing some ideas that over the years I found helpful to better help people, to better understand people, and to better understand the behavior of people of all layers of society, of all backgrounds, of all genders, colors, whatever, humans in the context of their history, present, and future. And it's so important to look at the individual in context. And we all are individuals, we all have issues in life. That does not necessarily mean that there's something wrong with us. We are just human, right? The work of being human is adapting to changing conditions. We have been used of asking only what is wrong with this brain, especially what's wrong with my brain. But really shouldn't be the question be what has this brain been responding to over time? And to really hear the history, the stories that shape a life. Because There's no easy answers in life, but we need to focus on proportionality, on dignity, and context. Let's create together a space or spaces for deeper understanding of what health, suffering, and healing actually ask of a human life. Thank you.